So today we are going to discuss a point regarding modern newborn care, right? So modern newborn care, uh, it is essential to prevent neonatal mortality and morbidity and mortality, right? So to prevent mortality and morbidity, so the newborn care is very important. It is a particularly get divided into three things, which are those. First first is a routine care, second is observational care, and third is a post resuscitation care. So right, so these are things which are this is a particularly get divided into three things. First is a routine care, which is a normal routine after the delivery. Why it is important? It Because it has no assistance required, right, to get stable after the birth. Second is observational care, which is for baby for whom it is necessary for the baby delivered with the complications during the labor required some assistance may get stable. He required some assistance, so observational care is important for those baby. So third is a post resuscitation care for baby delivered with the complications, for those baby which are delivered after the complications during the labor, right? So require the resuscitation to get stable after the birth. So for those baby requires the this kind of a post resuscitation care, right? So understand, first is a routine care, second is observational care, and third is a post resuscitation care. So next we will see what is a routine care. First we will see it in detail now. So first we will see routine care. So first is a routine care. So what they have given in routine care, that routine care includes nutrition, hygiene, and fostering emotional bonding between the baby and the family, right? So nutrition here in a normal routine or routine care, nutrition, hygiene, fostering emotional bonding with the baby and the family, etc., has been explained. So first is immediate, and in routine care there are some points which are get divided. First is immediate care after the birth, which care we have to take after immediately birth of after the immediate birth of the baby. Which are the delivery room protocols? First we will see prevention of the hypothermia. So what is a hypothermia? Where is the body temperature which goes below of the normal temperature. So here the delivery room should be pre-warm, right? So delivery room has to be pre-warm. Next is the baby must be dried promptly after the birth using clean, soft linen or cotton cloth. We have to clean the baby or dry properly. Wrapping the babies in a cotton, we have to wrap the baby in a cotton cloth, helping to retain the warmth. So to regain its normal body temperature, we have to wrap it into the cotton, right? So use a radiant warmer. We can use the radiant, even we can use a warmer for at least 20 minutes, ensure the baby remains warm. So we can even use a radiant warmer, right? So next step is a cleaning. So the mouth and nasal cavity should be cleared using the suction or a sterile cotton. We have to clean it, or even we can use gauze cotton, which are particularly used in hospitals, so it can be clean through that, right? So and B point is the eye should be clean with what? Sterile cotton, wiping gently from the inner to outer canthus. From inner canthus to outer canthus we have to clean it, right? So this was a cleaning. Next is the third is a vital sign examination. What are the vital sign examination? First we have to assess all the vital signs and ensure the stability of the baby. Third is the early breastfeeding initiation, right? Transfer the baby to mother as soon as the possible to promote breastfeeding and bonding. We have to transfer the baby to the mother as soon as possible to promote breastfeeding and bonding in between baby and the mother. So these are the immediate care after the birth which we have to take care. Second is what are the day-to-day postnatal cares? So we will see that. What are the postnatal care we have to take care? First is the thermal care. A first bath should only be given once the baby's vital signs. We have to give baby to bath only if the vitals of the baby are normal as well as stable. If it is not, we have to avoid the bath. Right? Ensure the baby remains warm by covering them and appropriate cloth. We have to ensure the baby is covered with appropriate cloths and giving proper warming to the baby. Third is avoid, what we have to avoid, exposing the baby to the excessive cold and newborn care room. We have to avoid excessive coldness to the newborn throughout the room. Right? So these are the things we have to take care in thermal exposure. The second point is hygiene care. Which type of hygiene we have to take care? Hygiene of the umbilical cord. Keep the umbilical cord cold and dry. Do not moisten or apply traditional agents. We have to not apply any kinds of agent to it. uh, right, yeah, if a cord becomes soiled, it get mesh, stool, or with stool or urine, we have to clean it. For B is skincare. Which skincare? Clean the newborn with the warm water and mild soap during the baths and ensuring they throughout the dry afterward. The nutritional care. Which type of a nutritional care we have to take? Right. So breastfeeding should be common as early as possible. We have to start breastfeeding as early as possible, right? Ideally immediately after the birth. When the baby is born, we have to start breastfeeding, right? So continue intervals at every 2 hours. In between the 2 hours of interval, continue breastfeeding is important. Why? Because first milk is called as colostrum, which is a very nutrient rich first milk, right? It is a nutritious for the baby and important for what baby's immunity and growth. It is a very important factor. Following breastfeeding, the baby should be burped to prevent discomfort and regurgitation. For premature or a weak infant unstable to suck adequately, some weak infants are unable to suck adequately, express breast milk should be provided every 2 hours using a spoon. So for those baby which will not able to suck the adequate milk, we have to feed it throughout a spoon. In case where the maternal milk is unavailable, formula milk should be given to prescribed doses. So these are the nutritional care. Third is a the fourth they have given is emotional care. Which emotional care? Mother and family members should be demonstrate warmth and affection toward the child while handling the baby with care. So emotional bonding is a nurtures the infant sense security and overall well-being, right? So we have seen what are the observational care in neonate and its management, right?